Hi, this is Dr. Castanet again. This time I'm going to review a lumbar MRI scan of a patient. This is not a patient I treated, but he wanted a second opinion from me. He had a friend of his bring his CD to me. He's in Maine, and I am far away in Decatur, Georgia. Nonetheless, I was happy to look at this MRI scan for him. He's scheduled for surgery, a discectomy at L4, the L4-5 disc. I'm going to show you what it looks like. He has left sciatica also. He's been dealing with this pain for many years, he says, and he's at the end of his rope. He's tried chiropractic, he's tried physical therapy, he's tried 2 different injections. None of that has helped sufficiently, and he needs to reclaim his quality of life, which has been miserable for a long time. He's 36 years old, a male, and so let's review these images, and I'll tell you what I see and what I told him. In this particular image, we see the disc herniation right there. This is the L4-5 disc. There's the L5-S1 disc. That's the top of the sacrum. This is his back over here. This is his front here, his abdomen. These are the vertebrae, of course. That's the L5 vertebra, L4, L3, L2, L1. These are T1 weighted images, so the colors are different than the colors we'll see in just a moment on some of the other slices, the T2 slices. He's got a large disc herniation here. I think you'll appreciate it more in some of the other images. But this is a large disc herniation, and this is the one that he's going to have treated surgically with a discectomy. He had another surgical opinion suggesting fusion at this level and this level, also in a discectomy at both levels, and I'll show you why in just a moment. But he's opting for the discectomy at L4-5, and I think that makes a lot of sense. So let's go to the next image. This is different colors. It's easier to see things. There's the large disc herniation at L4-5. We see a little white there. That's a little tear in the disc. That disc is darker in color than, say, this disc. So this disc has some water loss content. This is what degenerative changes look like. This is a little grayer in color, not as bright white as that. So this has lost some water content. There's some degeneration there. There's a little white, an annular tear right there. This disc looks thicker. It's also kind of gray as opposed to as dark. It's not as dark as this, nor as white as that. So this is, let's say, moderately degenerated with this fairly large herniation seen in this particular image. And this disc looks reasonably good in terms of height. Again, the gray appearance, but neither white nor as dark as this one. And it has a small disc herniation in this particular slice. Let's go to look at some of the other slices now. Same thing in this slice. We see the L4-5 disc herniation there. The canal here is fairly narrow. I asked him, and I haven't seen the report, if they discussed stenosis, perhaps congenital shortening of the pedicles, which can make this canal more narrow. He said he didn't hear about that from the doctor. South Asians often have congenital stenosis of the pedicles, and he is South Asian, specifically Indian. This is, again, the large disc herniation. This is a smaller disc herniation at L5-S1. I'm going to proceed to the next image. This is a cross-sectional image. This image is at the bottom disc, the L5-S1 disc. He has left-sided sciatica, and I think it's from this disc herniation, though I can't say for sure because the disc above this is much larger and occupies almost the entire canal. I can tell this is the L5-S1 disc because here's the sacral wing or ala on both sides. So this disc is above the sacrum, just above the sacrum. And we also see some atrophy and fatty infiltration in the multifidus muscles here in the low back. You see the canal, all this white area is nice and large here, but all this dark tissue shouldn't be here. This should be white, symmetric with this side here. So this is present herniation at L5-S1 compressing the S1 nerve root right there. So I have some concern that the surgery won't give him relief of the sciatica on the left side. And remember, this is the left side on this particular image. It's on our right when we look at it, but in terms of his anatomy, because of the way he's laying on the table face up with a head at the far end and the legs at the near end, or feet at the near end facing up, that makes this the left side. So I have some concern about just doing a discectomy at one level, but the alternative is not good. The alternative is, doing a discectomy at both levels, and most doctors in that circumstance will recommend fusion of both levels, and that's definitely not recommended if it can be avoided. So we'll see how he does. It may be that the conservative physical therapy treatment will do better after the surgery at L4-5. On the other hand, I asked him what he did in therapy, and he's not tried any traction. If he lived anywhere near me, I would say, please come in and do spinal decompression treatment. We'll see how good we can get this. It still might not resolve the massive disc herniation at L4-5, but it might. And it might improve this enough so that his surgical outcome, if it's limited to a discectomy at L4-5, gives him great relief. But this could be addressed with traction after the surgery also, so long as you give the soft tissues a chance to heal first. So I'm going to go to the next slice. This one will be the L4-5 level, and look at the canal. Should be light in color, white, and it's occupied by a large part of that disc herniation we've seen. There's very little space in there for the nerve roots, so I think it makes a lot of sense to remove this disc mass and see what's left after surgical removal of this, and that is in fact what he's going to do. So he was assured that I, consider myself as a provider of the most effective non-surgical alternative, that I thought his doctors were making reasonable choices and thinking reasonably about how to provide likely improvement for him, with the stipulations that I've already noted. I am Dr. Craig Castanet in Decatur, Georgia. If I can help you with your neck or back pain, please call me, 404-558-4015. If you'd like to learn more, you can go to my website, backstrong.net. You're also welcome to go from the website to my YouTube channel link at the top of the website, where you can watch many more videos. I also have a number of videos on the blog of the website on a variety of topics, including reading lots of MRI scans, and on the YouTube channel, I have a lot more videos on everything from surgery to pain management to anything else related to neck and back pain. Thanks very much. See you next time. Bye-bye.